When dealing, with issues such as, and particularly with patients in healthcare, and particularly dealing with substance abuse, engagement is really paramount. And I know the E word is used a lot, and sort of people try to shy away from it, but the reality is, if you don't have all elements of the ecosystem, the patient, the providers, the pharmacists, clinicians, all engaged, many great solutions fall flat, have fallen flat, and will continue to fall flat. And so what we provide is that ability to connect all those pieces. Like if you look at the last mile between the patient and all the various solutions, as Wendy described in terms of monitoring. So we help monitor solutions and deliver them to the telehealth solution, which is event-based. And we find that as a way to enable them to get better sense of what they're doing and who they're doing with it. So the kind of work that we're doing is we work in both the public and private sector, as Neil mentioned. We're doing pre-op and post-op work. We do wellness work in the public sector, in the private sector. In the public sector and federal group, we're doing work in such as areas as post-traumatic stress, high-risk suicide. We do substance abuse. And in fact, in some cases, you have populations who encompass all three of these. Particularly as a group, we're working actually in the VA, which is a maternal care program that involves combat-trained female vets suffering from post-traumatic stress who are pregnant. There's a high incidence of substance use, and there's a 78% probability of a suicidal event. So with that, we've gained, in working with our clients and helping them provide their solutions. Again, it's our solution working with them to better enable our clients with what they're doing. We've gained a lot of insight in the whole area of opioid management, and we're always looking to expand the breadth of what we're doing and how we can help our clients further. And in fact, that regard, I'm very excited that today was the public announcement of Ike Harper, who's at the back of the room, who's a former colonel in the U.S. Army and the chief pharmacy consultant for a number of years for the U.S. Army, who's come on board as our pharmacy consultant to help us in medication management, particularly dealing with the areas of opioid management. So in terms of the technology and patient engagement, really the objective is what you need to do is where the technology is almost invisible for that conversation to happen. You want to take away the communication barriers to the extent that you can. And so what we're always striving to do and do with our clients is to take the situation where you have it's as if the patient and the clinician or the provider are sitting in front of each other, but treat it on an automated and remote basis. So take those relationships and expand it. And again, key to that is reducing the whole barriers to communication. So what we do is the patient could determine whatever device they want to communicate on. So they could be a mobile device, could be a computer, could be a laptop, could be a landline, and they choose how they want to communicate. So it could be text, email, interactive voice, chat, instant message, any number of apps. We actually now tie into over 400 wearables and medical devices, and without the need, no software whatsoever, no special equipment. It's whatever device they have, and it's instantaneous. That starts the process of a communication that our providers have with their patients. And also for this, it's crucial to break down as many barriers as possible. So it's not just engaging the patients, as I said, it's engaging the clinicians and the providers. So instead of telling them, oh, you got a whole bunch of new things you have to do, we literally work with them to say, however you're whatever you're doing now, whatever your workflows are, whatever your protocols are, that's what you can continue to do. We just automate the process and use the rules engines and the rules of our clients to essentially automate the process, but escalate the exceptions so they're notified when they want to be notified about what they want to be notified to allow them to manage the patients that they want to manage at that point in time. So again, it's taking all these experiences that we've taken and working with our clients to deal with particular areas. One, as I mentioned, is substance abuse and opioids. And it's a great slide if you can only see it. So imagine, if you will. They'll be good. Right. So again, an example is with one of our clients, we're dealing with substance abuse and opioid management, and their whole issue was relapse. In their particular case, they had an average of 30% relapse. They've reported to us when they've used LifeWIRE with their system, it reduced down to 13% in the relapse with that population, and continues to refine. And again, this is what we're enabling our clients to be able to do. It's not our protocol, it's really using their system, but managing in a way using our platform to allow them to communicate to a broader population that they hadn't before, and allowing them to communicate how they want. Because again, it goes back to don't tell them how to communicate. Don't let them tell you how they want to communicate. If they want to use a cell or a text or email, and it changes over time, depending who you're talking to. And if you're dealing with, again, our experience in post-traumatic stress and substance use, sometimes they change even devices. And so it's key to be able to have them comfortable communicating with you, and at the same time be able to follow them at the same time, all with permission. So it's all, they're the ones engaging the system. But the respect that they get through this process has been empowering from our experience that we've had. So in particular to the discussions that we're having, and as Wendy had said, we're building a collaboration of companies really to demonstrate how to use blockchain linked with patient engagement and population monitoring to explore how to connect all the sort of the dots of data and patient engagement with the goal of helping to reduce addictions. And so, ultimately, patients need help managing their discomfort. Post-surgical pain is a perfect example. And as an example of contributing to the opioid crisis. And providers do want to help, but it's how do you help and how can they help? And it's something they're all looking at. But reality is real-world logistics tend to get in the way. So by using technology to sort of continue the conversation, even on a virtual basis, with the patient, help manage their transition to over-the-counter or whatever the transition pieces are, is critical to helping to reduce the addiction. It's part of the process. We're not saying we're the solution, but it's working with the solutions and helping to pave that way. So again, for this, as Wendy had mentioned, for this collaboration, LifeWIRE is really involved in patient enrollment and records consent as the start of the process, because it's a very consent-oriented piece. And who are identified by the provider and, again, with permission from the patient themselves. And then it's entering into an interactive and proactive messaging and dialogue relationship with those particular patients, tying in the providers and the various elements in the system. So for greater examples, pieces of what we're looking at, again, this is a demonstration project. We're still putting some of the pieces together, but the idea is really to be a recorder of the patient's status and some of the provider status, some of the pharmacist status throughout the process, interacting with the blockchain. Again, PII staying offside, but collecting de-identified information. So the patient will, can self-report prescriptions, can self-report going onto the prescription system. How are they managing the pain? Are they engaging with our system or not? One of the things that we looked at, and this came out of the behavioral health side, and the biggest knock against communication is it's good as long as somebody's communicating. Well, one thing we did learn in behavioral health was the fact that non-response is a choice. In fact, a non-response is a response. So we actually enable our clients to measure non-responses and treat it that way. So if somebody doesn't respond to 2 messages, or if they haven't responded in an hour and a half, that can trigger a whole series of outreach, either to themselves or to the community of care in the ecosystem. So you get that 100%, you know what's happening to that patient or the information you're looking for at any point in time. 2 other things we're looking to measure is is there any unused medications? It's self-reporting and interventions in the needs of either, again, the provider or the patient. Are there leftover medications? Have they completed the course of medications? Again, it goes on and on. I don't want to overwhelm you with all these points, but the key thing is there's a wealth of information to gain to add to the insight. And I think it's really, we're at the tip of the iceberg to really get a sense of really what are helping to what drives some of these issues and what help to help the patient and treat them as an individual as opposed to saying, here's the solution, and to be able to zero in more clearly into technologies such as the blockchain and some of the things that we're using and other partners to help individualize that issue. It's kind of precision medicine, but it's a bit on the side in terms of precision behavioral health, for lack of a better term, is really what we're aiming to do, and looking forward to working with this demonstration project as just the start of what works and what doesn't work, but what kind of insights can we get. So again, thank you all very much for your time today. I appreciate the opportunity.